name is Elizabeth. I'm gonna be recording.
Okay, so I'll start knocking into hand hygiene. Hello, my name is Jay. I'm gonna be a nursing student today. Is it okay if I do a physical assessment on you right now? Okay, good. Can I please have your name and date of birth? Okay, thank you. And then I'll check the patient's wristband if it matches. Okay, it matches. Okay, we're looking at my patient. Patient looks like their stated age. Facial expressions are smiling and relaxed. There's no signs of any distress. And patient's behavior is cooperative and non-competitive. Okay, I'm going to be asking you a few questions. Do you know who you are? Do you know what month it is? Do you know where you are? And do you know why you're at the hospital? Okay, good. Patient is orientated ×4. Their speech is fluid and clear. The patient just took a shower, so they're well groomed and clean. Patient is on a supine position on the middle of the bed. Patient is independent and able to walk properly. They're not using any assistive devices. They're using only one pillow, and they're not using any involuntary muscles or movements. And the patient's body is symmetrical. Okay, I'm going to be starting with some vital signs. I'm going to put your gown down a bit. Okay, I'm going to start with the epivocal pulse. I'm going to oxytate it for a minute. Place my stethoscope on the midline of the clavicle where the 5th intercostal space. Okay, once the minute is up, heart rate was 77, rhythm was regular, and it was +2. Okay, then I'll palpate the patient's radial pulses, both at the same time. Okay, radial pulses were 77, +2, and regular rhythm. Okay, now I'm gonna watch the patient's respiration rate. I'll watch the patient's chest rise up and go down. Respiration rate was 18. Patient is breathing through their nose using room air. Patient was not using any accessory muscles, and they're breathing normal-labored. I would also do oxygen saturation. Oxygen saturation was 98. Then I would oxytate the patient's blood pressure. I'll place my stethoscope on the brachial artery. Okay, and then I'm gonna inflate it. Okay, blood pressure was 120/80. That is in the normal range. And then I would do the patient's temperature. Today I'm going to be doing an oral temperature since my patient had eaten already and had fluids before the physical assessment, and it was already 20 to 30 minutes already. I would have done a tympanic temperature if there was no sign of ear pain or discharge. I would have done a rectal temperature if I wanted an accurate reading or patient did not have any seizures of history of seizures. I would have used an axillary temperature if there was no sign of fungal infections. Okay, and then temperature was 98.3. It is within the normal range. Now I'm gonna assess the patient's head. I'll see how overall shape is. Overall shape is round and symmetrical. Facial expressions are symmetrical. There's no signs of drooping. The lip and skin color matches the patient's ethnicity. Lip is moist, skin is intact. Patient's head and hair scalp. There's no signs of lesions, tenderness, or lice or dryness. Patient's neck is symmetrical, shoulders are even, and the trachea substernal notch is in the midline. Okay, then I'll do general palpations on the patient's head, making sure there's no masses or tenderness. Okay. Then I'll palpate the patient's carotid artery. I'll do one side at a time. Okay, that was +2. And this was also +2. Okay. Then I'll palpate the patient's lymph nodes, starting with the preocular, postocular. Back of the head is the occipital, tonsillars, submandibular, submental, anterior cervical, posterior cervical, and supraclavicle. Okay, lymph nodes were non-palatable. Now I'm gonna assess the patient's head, patient's eyes. I'll inspect the patient's overall eyes. Their eyes are symmetrical. Eyelids are symmetrical to the patient's eyes. The pupils are in the middle. Eyebrows are symmetrical as well. I'll assess for any lacrimal drainage. There's no signs of that. The conjunctiva is moist and pink. Conjunctiva is moist and pink. And the sacra is white as well on the other side. I'll check for perla. I'll see how their pupils constrict or dilate. The patient's eyes are equal and they're round. And then I'll also check how they react to light and also check for accommodation. I use the light side to side, the other side as well. Okay, good. They constricted 4 to 3, and then I'll check for accommodation. If you can follow my pen light, please. Okay, patient was able to follow my pen light. And then I'll also assess for extraocular muscle movements. And I'll ask the patient to follow my pen light. Okay, good. Patient was able to follow my pen light. Now I'm gonna assess the patient's ears. I'll look at if there's any drainage, if there's any ear pain. I'll assess the ocular, the labial, and the tragus if there's any pain there. There's no pain. I'll go on the other side. I'll assess for the ocular, the tragus, and the labial if there's no pain. Assess if there's no drainage or any ear pain. There's no signs of that. During the conversation, patient was able to hear me and respond well. I would also check for auditory acuity. I'll cover the patient's ear, whisper some words like 1, 2, 3. Patient was able to hear me and say 1, 2, 3 back. I'll also do it on the other side. 1, 2, 3. Patient was able to hear me and say it back as well. Next, I will assess the patient's nose. I will cover one nose at a time to check flaring and patency. Okay, patient was able to breathe through the nose. And then I'll assess the spectral dividation if it's in the midline of the nose. And then I'll also check for mucosa membrane, making sure it's moist and pink. Okay. Then I'll assess the patient's mouth. Making sure the uvula is in the right position in the middle of the mouth. The tonsils are there. Bronchiole is there, moist and pink. The subjective mucosa is intact. Gums are pink and moist. There's no signs of bleeding. I would also check for any decay, any loose teeth, or any dentures. Patient's teeth are intact. There's no signs of dentures and any decay. And then I also assess for hard plate or soft plate. Okay. Then I would assess range of motion on the patient's head. Check the patient to move against my head. Okay, patient was able to do that. Next, I'm gonna do the cardiac and respiratory assessment. First, I'm gonna start with inspecting the patient's breathing. Patient is breathing through their nose. They're not using any accessory muscles or retractions. Patient is able to breathe at a supine, prone, and upright position. There's no signs of coughing or spectrum. Then I'll be checking for jugular vein dimension. Make sure the bed is on a lower position. Make sure they're on a supine position. Make sure the patient is looking the other way from me. And then I'll assess the patient's neck. There's no sign of jugular vein dimension. And then I'll instruct the patient to look this way so I can look on the other way. There's no sign of jugular vein dimension as well. Okay. Then I will assess the patient's chest, making sure It's symmetrical and normal ratio. Normal ratio is 1:2. I will inspect the patient's extremities, making sure the patient's extremities, there's no signs of deformities. Patient's color matches the patient's ethnicity. There's no masses or tenderness, no deformities. Nails are nice and trim. Toenails are nice and trim as well. And then I'll be checking for cavity refill on each finger. Okay, that's less than 3. I'll do it on this side. Less than 3, okay. Then I'll check on your patient's toenails. Okay, less than 3. Then it was less than 3 as well. Okay, now I'm gonna start with palpating. I'll palpate anterior of the patient's chest, making sure there's no masses, tenderness, or crepitus. I'll do it on the laterally side too. And then I'll also do it posteriorly. And there was no signs of masses or tenderness or crepitus. I'll palpate the patient's cardiac landmarks, starting on the right side, on the second intercostal space where the aortic valve is. Going down to the left side, on the second intercostal space where the pulmonary valve is. I'll go down to the third intercostal space where the urn point is. Go down to the fourth intercostal space where the tricuspid valve is, and going down to the fifth intercostal space where the mitral valve is. Okay, now I would palpate that to check if there's any hives or lifts. There is no signs of that. Then I'll palpate the patient's thoracic chest, making sure it's symmetrical and in normal depth. Okay, good. Then I'll palpate the peripheral pulses. I'm gonna start with the radial pulse. Okay, radial pulse was regular and it's +2. Then I'm gonna do the femoral pulse. Okay, femoral pulse was regular and +2. I'll do popliteal pulse, which is in back of the knee. Okay, it was regular and +2. I'll do posterior tibia. Okay, it was regular and +2. And then I'll do pedis. That's regular and +2. Okay, good. And then I'll also check for the extremities temperature. And then it's warm. Upper extremities are also warm. Okay, good. And then I'll start with oxytating. I'll oxytate the patient's lungs. And then I'm gonna be using a ladder pattern. I'm gonna be starting on the right side. I'll ask the patient to breathe in and out. Okay, and then also do laterally. Okay, good. And then I also do posteriorly. Lung sounds were clear. There was no signs of crackles or wheezing. Now I'm gonna oxytate the patient's cardiac landmarks. I'm gonna start on the right side, on the second intercostal space where the aortic valve is. Then I'll move down to the left side, and then this is the pulmonary valve is. Okay, then I'll go down to the third intercostal space where the urn point is. Then I'll go down to the fourth intercostal space where the tricuspid valve is. And then I'll go down to the fifth intercostal space where the mitral valve is. Okay, heart sounds were regular, that was +2. Okay, now I'm gonna inspect the patient's abdomen. Patient's abdomen matches the patient's ethnicity. The color matches the patient's ethnicity. It's symmetrical and normal depth. There's no signs of pulsation, petechia, no scars, no masses or tenderness. and the umbilical is in the midline of the abdomen. Then I will also inspect the patient's genital. I'll make sure there's no deformities, the skin condition is intact, the color matches the patient's ethnicity, and there's no signs of lesions or discharge. Patient did void earlier. The color was yellow, clear, and no odor. The patient also had a bowel movement. The bowel movement was formed, brown, and there was a decent amount. Okay, now exudate the patient's abdomen, and I'll exudate the 4 quadrants. I'll start on the right lower quadrant, then go up to the upper right quadrant, then move down to the left upper quadrant, and then move down to the left lower quadrant. Okay, good. Bell sounds were normal and active. Then I'll use light palpations, and then I'll palpate to make sure there's no masses or tenderness or pulsations. Okay, good. There was no any of that. Okay. Then I will inspect the patient's upper extremities. The skin condition is intact. The color matches the patient's ethnicity, as well as the lower extremities. Patient matches, the color matches the patient's ethnicity, and there's no sign of deformities. Patient did walk earlier. There is no signs of tics or tumors or spasticity. Patient's gait was even. Patient was also tested for the Romberg test. They tested positive. They were able to close their eyes, stand still, and lose balance. Then I would inspect the upper extremities. Upper extremities are symmetrical to the patient's body. I would palpate for muscle tones or the joints. I would also assess for masses or tenderness. There's no signs of that. And then I also assess for edema. Okay, there's no signs of edema. I'd also do it on the lower extremities, making sure there's no masses or tenderness. Okay, also check for edema. Okay, there's no sign of edema, it's +1. Then I would assess for a patient's sensation of touch and pain. I would ask the patient to close their eyes, and I'm going to start with the upper extremities. I'll ask the patient if they feel any soft or sharp pain. Okay. Okay, patient was able to tell if it was sharp or pain. Doing on the other side. Okay, patient was able to tell me if it was soft or sharp. Okay, patient was able to tell me if it was soft or sharp on the lower extremities. And patient was able to tell me if it was soft or sharp on the lower extremities. Okay, then I'll assess for muscle straight. I'll check the patient if they can squeeze their hands for me. Okay, good. I'll ask the patient to move down against me. Okay, good. Move up against me. Good. I'll do the lower extremities as well. Ask the patient to move up against me. Good. Move down against me. Good. And then I'll ask the patient to push their feet like a gas pedal. Okay, good. Muscle straights are intact and normal. I will also assess for range of motion. I'll ask the patient to follow my movements. We're going to start with supination, pronation, abduction, adduction, flexion, extension, and then circumduction. Okay, good. Patient was able to follow my moves. All range of motions are active and intact. Before I leave, I'll ask the patient if they need anything. They do not need anything, and I'll make sure the call light is within reach. Okay, and I'm done with the physical assessment.